Good morning, team. Excuse me.
Good morning.
Good morning.
Good morning.
Good morning.
Oh my goodness.
Good morning.
It looks like we might already have a quorum. What say you, Joseph?
Thanks, Dr. Durrett. I was going to go ahead and take a quick roll call just to make sure. Just so you know, I believe you already are aware via email, Dr. Durrett, but Braden Strag, one of the commissioners, he is absent today. He wasn't able to make the meeting.
Right.
However, he did say over email that he agrees with the draft letter. So just for that. Same with Jasmine Troop, another commissioner. She's unable to attend today, but she said she agreed. However, I know that it's going to be open for discussion in a little bit here. But I'll go down the list of commissioners, take a quick roll call. So Dr. Lisa Durrett.
Present.
Thank you. Lisa Ruiz-Lee.
Present.
Thank you. Natasha Mosby. All right. Dr. Gregory Jerome. Arvin Operario.
Present.
Billy Miller.
Good morning, present.
Thank you, Billy. And Dan Ficalora.
Morning, present.
Perfect. So that does make 5 commissioners present, which means we do have a quorum to start the meeting today. It is 9:01 a.m., October 14th, 2021. I'll hand it over to the Commission on Behavioral Health Chair, Dr. Lisa Durrett.
Thank you, Joseph. And I see a lot of names here. For everyone to introduce themselves. Joseph, if you wouldn't mind, since you're taking notes anyway, can you just go through and let's call everybody out to make sure that we know who everyone is. And then with your permission, I'd like to screen share because I have a version, I have the letter pulled up in an editable version because I suspect we're going to have some changes to make through this call. And I figured it might just be easiest to type it as we go and then everybody can see it.
Okay, perfect. So I'll go down the list. If you could just state your name and then introduce yourself for the record. So Alex Tanchek.
Hi, Alex Tanchek on behalf of Silver State Government Relations.
Thank you. Dr. Neighbors. We'll come back to you, Dr. Neighbors. Christina Brooks.
Christina Brooks, Agency Manager for Northern Nevada Adult Mental Health Services, or NAMS.
Thank you. Dana Gentry.
I'm just a journalist.
Thanks, Dana. Dina Schmidt. All right, we'll come back to you, Dina. I know that Dina Schmidt is the Administrator over Aging and Disability Services. And then Dominique Rice.
Hi, I am the Deputy Administrator of Quality Oversight with DCFS.
Thank you.
Thank you.
And Ellen.
Hi, good morning. Ellen Richardson Adams, Outpatient Manager for Southern Nevada Adult Mental Health and Rural Clinic Services.
Thank you. And I see that Dr. Gregory Jerome, another commissioner, joined. Do you want to just confirm you're here?
I'm here.
Thank you, sir. Juan Caver.
Yes, good morning. Juwan Favor, Clinical Program Manager at Des Regional Center, a part of the Aging and Disability Group.
Thank you. Jessica Adams.
Good morning, Jessica Adams, Deputy Administrator with Aging and Disability Services over the regional centers.
Thank you. Julian Montoya.
Yes, good morning. Julian Montoya, Sierra Regional Center Agency Manager under ADSD.
Thank you, sir. Joe Millay.
Good morning, Joe Millay, Deputy Administrator of Clinical Services with the Division of Public and Behavioral Health.
Thank you, Joe. Katie Martin Waldman.
Morning, Katie Martin Waldman with DCFS Planning and Evaluation, Clinical Program Planner.
Thank you. Lisa Sherrick.
Hi, good morning. Lisa Sherrick, Administrator for the Division of Public and Behavioral Health.
Thanks, Lisa. Marina Valerio.
Good morning, I'm Marina Valerio with Desert Regional Center. I'm the agency manager.
Thank you, Marina. Rex Gifford.
Morning, yeah, Rex Gifford, Division of Public and Behavioral Health. I'm an Admin Assistant 3.
Thank you. Susan Lynch.
Good morning, Susan Lynch, Hospital Administrator for Southern Nevada Adult Mental Health Services.
Thank you, Susan. And Therese Wickham.
Good morning, Therese Wickham, Agency Manager for Lakes Crossing Center in Sparks, Nevada.
Therese. Valerie Balin.
Hey all, Valerie Balin with Bells and Case Government Affairs.
Thanks, Valerie. Stan Cornell.
Good morning, Stan Cornell, Agency Manager for Stein Forensic Facility down in the south.
Thank you. And let's go back to Dr. Neighbors.
Betsy Neighbors, I'm the statewide forensic director for DPVH.
Thank you. I think I got everyone. If I didn't call upon you, if you can please just unmute yourself and state your name for the record.
Good morning, this is Dina Schmidt. I'm the Administrator for Aging and Disability Services Division.
Thanks, Dina. And for the record, I'm Joseph Filippi, Executive Assistant for the Division of Public and Behavioral Health. I'll hand it back over to you, Chair.
Great, thank you. And can you give me, whoopsie, can you give me screen sharing ability, please? All right, so just to quickly get everybody back on the same page, we had our commission meeting. I can't remember the date, approximately 2 weeks ago. And we've seen this recurrent pattern where many of our state agencies are struggling with recruitment, and Commissioner Mosby just came on, recruitment and retainment of staff. And it's been becoming worse and worse. Up to the point that as we went through our agency reports at the last meeting, we discovered that even some of the SLAs, assisted living facilities, have been closing because of their inability to staff adequately. And we know that there have been a lot of difficulties in staffing recruitment and retainment throughout the state that have been worsened by the COVID pandemic. And actually, Joseph, if I'm able to share, then I have the editable version and I can type as we go. That would be great. And so,
Dr. Durrett, I also have an editable version available. It wasn't letting me share with permissions with you for some reason. So if you'd like, I can make the suggested edits as we go.
Just as well. Now I don't have to do it. Thank you. And so we as a commission made a motion, voted and improved that the commission really needs to speak up at this point. We are a group that has been charged to support, to advocate for best care for the patients that are served by the mental health services within the state of Nevada. And we're not doing a good job as a state right now. And so as a group, we made a motion to create this draft letter to send to the legislature and the governor to point out that the salary gaps, the salaries for the frontline workers that are mental health technicians that are working at, say, Desert Willow Treatment Center, Lakes Crossing, Stein, Southern Nevada Adult Mental Health, that the amount that we're able to pay these individuals is significantly less than, say, they can get working at Amazon, working at Walmart. And thus the letter was created. Joseph, you've got your hand up. And now we're all here to edit the letter and approve it and then get it off.
Sorry to interrupt you, Dr. Durrett. I think we first need to move to public comment just to be formal, and then we can move to that agenda item to start that discussion. Sorry.
Okay, so yes, that was a very long intro. How does that go? Now let's have some public comment if there's any.
Reminder, if you're here to give any public comment, you can unmute yourself and state your name for the record. All right, hearing none, let's hand it back over to you, Dr. Durrett. Sorry for that.
Thank you, I appreciate it. All right, so given that there's no public comment, I want us to go back and look at the letter, refine the letter. And I have an ask of the group. It's beautiful to see so many agency directors here, because one thing that I was trying to do on my own, unfortunately unsuccessfully, was to find the actual hourly rate for frontline workers, to find that online. So I know anecdotally what it is from people that have these positions, but I was hoping some and or multiples of you could share that exact information. I think we should plug it into the letter. And then there were a couple of grammatical errors that need to be corrected. And so I'm going to open it to the floor for edits and amendments to the letter. And then once we put that together, we can get it out. So Billy, you've got your hand up.
Yeah, I think in addition to the salary that they're being paid, one thing that we heard when we were on the call was the amount of time that it's taking to hire. So I think that's important to put in there, because of course that's going to play into whether or not we can get individuals in timely, because we have other individuals leaving. And then also, if the agencies can provide us with specific information as to what the turnover is looking like, I think that would be important to add to the letter as well, because all of those things are going to play into the care or the lack of care that our citizens are receiving.
Thank you. So I think you bring up a great point. And Joseph, if we could make a placeholder in here, I think it would be great to have a paragraph that essentially describes, and I think Therese, you were the one that brought it up in the last meeting, that from the time you identify a hire to the time that they can start working, there was a pretty significant gap. I think I remember it being close to 3 months. So does anybody in this call have that exact information of what the onboarding time frame is?
Chair Durrett, good morning. Joe Millay here with the Division of Public and Behavioral Health. I can tell you that it really does vary dependent upon the applicant and their references and everything and that kind of check. It can take as quick as a week to 2, and sometimes, unfortunately, it does take a month or more. So there is quite a range. So there is a challenge there at times, ensuring that all documentation is gathered, and so we can follow up on those references as well.
Excellent, thank you. And then in that same paragraph, and Lisa, I see your hand is up. I'll get you in just a sec. I want to finish Billy's comment, which is the turnover rate. So I know that every meeting, the agencies report their vacancies, but do the agencies report a rate for the vacancies, like of the current, of our staff, what percentage are vacant at any given time, rather than just the gross number of vacancies? Do we have that data?
Oh, go ahead, Dina.
So this is Dina. I know for the intermediate care facility, we can pull that information and give you kind of the percentage of turnover over the last year.
Great. So Joseph,
we don't have it,
put a phrase in that will add percent of turnover from any of the agencies that can submit that to us. And Billy, how does that satisfy what you were thinking? Because I think that describes those 2 line items you were describing.
Yep, I think we're good to go if we have that. Absolutely.
All right, cool. Thank you. Lisa Sherrick, you had your hand up.
Hi, good morning. Lisa Sherrick. So I did provide the information from the Division of Human Resource Management, state personnel, on the pay scales. There's actually 4 documents. I provided it to Joseph this morning. There is the one for the employer-employee. Then there's one for employer. If someone's vested more than 5 years, typically we go with the employee-employer pay scale for new hires. And then there's also the unclassified pay bills. So that information Joseph can share with the group, and you'll have that available. Perhaps what we can do is highlight which grades that we're talking about in the position, since there's a lot of numbers and information on those documents, so that would be much easier. In relation to the question about the time frame. I concur with Joe Millay that it does vary. I think one of the things that we have been struggling with recently is the transition from the state to go to success factors, which is a new recruiting system. So there's been some challenges with that program, especially when we are also doing an accelerated rate hire, which typically always occurs for our clinical staff. So if we're looking at nurses, LCSW, psychologists, we typically look at bringing them in near the top end of the scale because we know the competitiveness of the pay is not there, but that takes a little bit of a process. I think it would be ideal if there's a way to not have to have that 4 or 5 level review process and be able to expedite those hires, and perhaps addressing that process would be helpful for our staff and agencies. Thank you.
Thank you, Lisa. So Joseph, I recognize you're probably typing furiously. And so I think Lisa's 2 points are really good, that A, we will include the actual data. And, you know, this letter was really focused on frontline workers. So I appreciate, Lisa, you mentioning nurses and licensed clinical social workers and the like, but really it's the mental health technicians and the people that are hands-on with our patients on a daily basis. They're the ones for whom we have the greatest concern because they're paid at the lowest end of the scale. But we will pull out from the information that you sent, thank you, that exact information to include in the letter, and make a comment about the barriers that are inherent to this new HR system. So thank you. Commissioner Reesley, I see your hand is up.
Sure, thank you. This is Lisa Reesley for the record. So just a quick question for state administrators. I know that typically in government systems, there is a classification and compensation review process that evaluates sort of the issue that we're talking about, right? Which is how much are we paying people to do the work, and does it fit sort of within the scope of other comparable positions within our state, other states, those sorts of things. Do we have a formal cycle with the state of Nevada in terms of that cost and compensation review? And if so, when was the last one conducted?
So Lisa Sherrick, for the record, my understanding there is some sort of frequency. I do not have that information available, but we could look at that and provide that information. And that is, I apologize about the noise behind me, that is handled by state personnel.
And has state personnel engaged in this conversation or dialogue at all in terms of just trying to problem solve with you around this issue?
This is Gina, and from my perspective, no, we've not had an engagement with the state personnel offices. I mean, we brought the concern to their attention, but there's been no discussion about making changes at this point.
I just know that makes sense. I just know that there are formal processes for this. So in terms of the overall recommendation of the letter, I mean, certainly we're recommending that we evaluate these salaries to determine whether or not they're a barrier or a detriment. You're saying they are, and I believe they are, to hiring. But I think there are formal processes within state government that you could access and utilize that may also help to expedite resolution, or not, depending on how slow things do or don't go, right? But I think for our consideration as a commission, really saying this is an issue that needs to be studied and evaluated very quickly to come to quick resolution so that you can commence hiring these frontline workers, I think is really imperative. So again, I don't know what that language should look like, but I think my concern is that if we pack this letter with a whole host of data, that's really data that needs to be gathered formally by the state in a very expedited fashion in order to come to decision making around what these salaries should look like. So that's, I guess, my first comment. My second comment is, in the letter, we use the phraseology livable wage. And I just want to be very cognizant that livable wage has very specific meaning to it. And that geography determines what is considered a livable wage via like the Department of Labor. There are studies that they do to determine what is a livable wage. So I just want to make sure that we're not using that language casually, because it really does mean something. And I think that's part of the study that needs to be done, right, very quickly, which is, are these wages livable wages? And if they're not livable wages, then that's not acceptable. And we need to make them so that we can hire the people we need to do this very important work. So that's my 2 cents.
So thank you. I think you bring up two really good points. And Joseph, I'm going to work backwards from your 2 points. I see your cursor is right there. Could you add living wage in accordance with the Department of Labor's standards? Does that capture what you were trying to say?
I think so. I just want to make sure that we are real clear about what the salaries should look like. I mean, like livable wage is a thing. And we want to make sure that we're within that range. Now, the interesting thing about that, though, is that keep in mind is that, that number may vary slightly from community to community. So you have to try to craft that into your salary ranges, which is why the class and comp study is really helpful. I've worked in other state governments that do it every 3 years, and they do it every 3 years purposefully because they really want to make sure that they're capturing the salaries that are required to keep them competitive in the market and for hiring purposes. So again, if we've done that, what does that tell us in terms of our competitiveness, just to make sure that salary really is the issue?
So I want to capture those words that you just said in the first comment of the edits that Joseph had. You mentioned a specific study for assessing competitiveness.
They're class and comps, they're classification and compensation studies. In a sense, essentially what they do is they do a comparative analysis for the role, the scope. You look at like a job description, your knowledge, skills, abilities, competencies to do the work, and they compare it across like jurisdictions. So for example, I just worked on a project in South Dakota. South Dakota compares their class and compensation system to 6 other states as part of their review process. So what does Nevada's look like? I don't know, but it's a fair question to ask the Office of Personnel for sure. And to look at the data, the most recent data, even if it's years back that they've collected, to identify how it works or doesn't work.
So it's specific to class and compensation study that we're looking for.
Yeah.
All right, thank you.
And that would help. I mean, if you're talking, that would help not only with your frontline staff, but it would also help with some of your other critical, hard to fill vacancies. I mean, if in order to be truly competitive, you're having to come in routinely, and I know this happens because I spent many years working in government, but if you are having to come in routinely at the very top of the salary range, you may have solved today's problem by getting somebody to fill that position, but you could have a problem tomorrow because that person's not going to get a raise again. So it's a dynamic that should be evaluated. If you're constantly coming in at the top of the range, is the top of the range really, should it be the top of the range or should it be the midpoint of the range?
Well, thank you. I think that's a really good comment. Commissioner Operario, you've got your hand up. Can you hear us, Arvin? Or are you frozen?
Could you hear me okay?
Now we can hear you, yes.
Yeah, awesome. No, I apologize for that. Commissioner Operario, for the record. I just want to, I know Commissioner Lisa Ruiz-Lee already mentioned it, but anecdotally, yeah, that's definitely will be helpful in the decision making. I mean, if there's studies done, anecdotally, what I do here when I was teaching at the campuses here is our nurses are coming in at the lowest range. I'm not sure what is the lowest range now. I've been in state system for quite a while, but when St. Rose is offering $34 an hour for our, registered nurses, and they're being offered much lesser than that. I think it's not very enticing. Also, on the other end of that is we do have experienced nurses that would like to be part of the system, but needless to say, just because they have sporadic or undocumented mental health experience, they started at the psychiatric nurse 1, which is, even if you have 20 years experience in general nursing, but if you don't have documented mental health nursing, you start at the lowest cap. Again, these are experienced nursing. So my question, and if any of the administrator could oblige, is has that been looked at, or just an anecdotal, from when I was working in the system? So has that changed? Just that process changed already, or it's still about the same at this point?
Hi, this is Lisa Sherrick. Arvin, I'm sorry, has what changed? I missed that one piece of your question.
Yeah, the discussion when it comes to, offering salaries to whether it be a mental health tech or a nurse. Like I said, a couple points that I raised is experienced nurses that comes in, if they don't have any documented mental health experience, they start at the PN1, even though they'd been nurses for 5 or 10 years, right? And then on the second aspect of that same thing, we have CNAs that would like to be mental health techs. But then since they don't have documented mental health experience, nor has to go to our mental health program, they started at the lower salary grid or the grading. So is that still the same practice right now, or has there been discussion of offering mid-range? So I'm not sure what the process looked like at this point. So if you could kindly enlighten us, please.
So Lisa Sherrick, for the record, speaking on behalf of DBPH. I can't speak for the other division, but we do have a process that we look at experience, and then it determines what range they're going to, like how many years that they've been a nurse. So maybe not specifically they've had the mental health experience, et cetera, but whether they've been a nurse, how long. And then we use that skill or assessment tool to help us guide what step that they would be brought onto.
So Arvin, for the purposes of the letter, I wonder what the best way to articulate this could be. So I think there's a similar issue in the land of psychiatry, where subspecialist psychiatrists do not get paid significantly more for their expertise than a general psychiatrist, which then hampers the ability to have good psychiatric care. And so although we've been talking about frontline staff, you're right that clinical staff within the state are not being paid a competitive wage compared to the private sector, which gets back to what Commissioner Weasley was saying with the compensation study. So I'm sort of rambling here to say, how do we condense all of that into the recommendation of this letter?
Yeah, I think I'm sorry. Again, this is Commissioner Opera for the record. I think it's just for the purpose of the letter is we need to make sure that, like what Commissioner Luisa is saying is like, we add that in there that, it's a livable wage, make sure that we are competitive as a state too. I'm not sure if that would be part of this initial letter, but needless to say, we just want to make sure that everyone is fully aware. And I think they are fully aware of the challenges to begin with. So it may not be pertaining to this specific letter at this point, but in further discussion, just to offset some of the challenges that they're facing.
Thank you. Commissioner Ficalora, you've got your hand up.
Sure, Commissioner Ficalora for the record. I just want to be wary of mission drift with this letter, right? If we're really trying to focus on those entry-level frontline workers that we have the highest vacancies for, we should really make sure that this letter is targeted and pretty specific to those vacancies and to those turnover rates. Because I think that's probably where we're going to have the most success in getting some actual change in those levels. When we start getting into the clinical positions, the more professional positions, it might be a taller task and need more organizational or statewide shift than just trying to focus on these specific positions.
Thank you, and I appreciate you bringing that up because, you know, the initial intent of this letter was to really focus on our frontline staff as we discuss all of the issues. There's a reason that Nevada is ranked 51st in the nation for children's mental health and ranked equally low for adult mental health. And it starts at the front line and goes all the way up to the top with the highest level clinical folks and the system itself. So problems are abundant. That's why we're all sitting here and advocating. So I want us to come back to the letter, and from the initial body, you know, the purpose of this meeting was to make some final edits to the letter so that we have a product to send out. Obviously, at the conclusion of today's meeting, we have some additional data that we'll be adding into the letter to strengthen it. I don't know if one of our DAGs is on the line, but procedurally, my question would be, do we make a motion today to approve it with the discussed edits and then pass it around and get it out, or are we going to need to have a subsequent meeting? That piece I don't quite know. But I think it would be really important to focus 90% of this letter on our frontline staff, but to also include, which I think is completely a valid piece, what Commissioner Abreu was bringing up, which is the line that all of our clinical staff need to have their compensation packages reviewed to get them to a competitive place such that we're able to recruit and retain, because although there are far greater vacancies and turnover at the frontline staff side, we also have vacancies on the clinical staff side. And so this is really just a widespread issue within the state system. All of that is to say, number one, Joseph, I punt this to you and or a DAG on the line. Procedurally, are we able to approve the letter with the suggested edits today, fix the edits, get them around, or B, do we need to have a secondary meeting?
So unfortunately, the DAG, I'm texting them because they're in a conference. My gut feeling would be if the letter's not finalized during the public meeting, that if additional data needs to be added and edits need to be made, the commission would have to again review and approve it during a public meeting. I believe that's what we're going to have to do, unfortunately. So I'm happy to schedule another meeting, even if it's just next week or the week following. But I think as much as we can get done today, pending the additional data needed from the agencies, would be helpful. And Lisa has her hand raised.
Hi, Lisa Sherrick. So separate to what Joseph was just discussing, but I think for the purposes of the layout of the letter, I think it could be helpful to break out DBPH and ADSD within the letter because we have very different facility types per se, right? So obviously DBPH has the hospitals, and then are we only talking about inpatient? We also have outpatient needs for DBPH that would include the clinical staff. And then while I know ADSD has their intermediate care facility that has the developmental support technicians, they also have nurses. But then as I read this letter, I'm understanding this to also be talking about the residential supported living arrangement providers that they contract with that do a substantial amount of that community services program. And those are the frontline staff, as I read this, that we're talking about. So I think just having that a little more further defined, because when we're also the turnover rate. So if we're talking about turnover rate, are we talking about the state employees? And then for ADSD, are we actually talking about the providers that provide those jobs and day training services and supported living services, and then what those positions look like and so forth. So that would just be my suggestion, to make sure it's very clear for the governor and whoever else reads this, what the intent is and who we're specifically talking about. Otherwise, I think it's a little bit too grouped together to be able to pull out where the specific issues are. And then also, I don't know if there's the ability to have any type of comment or statement if the commission believes that this is necessary. But if there was work to be done on raises, especially for the contracted staff, that there's something that we make sure they actually get it. So if there is a provider rate increase, how do we make sure that that goes to those direct support staff that are providing that service versus more administrative overhead where it could sit?
So Lisa, before I go to Stan and Dan, do you have some sample language that you could describe? Could you just like throw out a suggestion for how to articulate that? Because this is my ignorance of how do you divide that out in verbiage for those three systems? Or what would be the titles of the three systems so that we could put that in our draft and flesh out paragraphs?
So this is Lisa Sherrick. I think probably starting on state staff, something about DBPH state employees, ADSD state employees, and then ADSD contracted what developmental or support staff. Dina or Jessica probably are the best to speak to that. I worked at ADSD, so I have a little bit of understanding, so certainly not wanting to speak for that division, but that would just be my kind of thought at this point.
And this is Dina. I think we've got some language I can send. Actually, some of our advocacy groups sent a similar letter regarding our direct support staff for community services, and I can pull that language and send it over to Joseph to add in here. Might be helpful.
Fabulous.
Yeah.
Thank you. All right, Mr. Cornell.
Thank you. Yes, I wanted to go back to the discussion we were having about nursing, and I'm sorry I would have brought this up earlier, but I was looking for the hand raising function. I just wanted to point out that for the hospitals, I can't speak so much for the civils, but I know with the forensic hospitals, our nursing staff are actually part of the milieu on the units. They're doing treatment, they're interacting with the patients. They are on our front line. So I just want to point that out.
Tough environment to work in.
Yeah.
Commissioner Ficalora.
To the point about staff, state employees versus contracted workers that are in the supported living homes, are the behavioral health techs and the frontline workers that are working in the supported living homes actually contracted at a rate, or is that rate given to the facility and then the managers of that facility decide how much those people are paid?
Good question.
This is Jessica Adams. We pay a rate to the provider, and then the provider hires those staff. So it is up to the provider as to what rate it is that they pay to the staff that are working within the home.
So yeah, I don't know how we would put that in this letter, but to that same point, if we're going to give a bump to the contracted facilities, we want to make sure that it actually goes to the people doing the work.
I agree. Commissioner Reesley, you've got your hand up.
I do. Thank you, Lisa Reesley, for the record. So this is just a follow-up question to that last statement. Has the state agencies who issue those contracts ever considered putting specific contract language in there about the rate of pay for the staff who do the work?
This is Jessica Adams again. That is something we're actively looking at now, that we have some of our DAGs looking at to see what we're able to do. There are some states that have been able to accomplish that. I know in the past there was some NRS that was proposed that would help with that, and it's never been able to pass. So now we are looking at the contract route, if there's some way that we can put it into there, so that we can make sure that that rate raises are getting passed on to those staff.
That makes total sense to me. So, and I think that would be of great support in terms of their ability to hire and retain staff. They may not necessarily appreciate it because it would likely affect their bottom line or their profit margin rather, but it would create a guaranteed wage for the salary or for the staff who do that work.
Absolutely.
Thanks.
Are there any other comments for edits and or additions to this letter at this point?
Commissioner Ficalora, for the record, just one minor thing. Let's take a look at the commissioners that are listed at the bottom of the signatures line. I think they need to be updated.
Oh, you got left out. We'll fix it. Good catch. So I want to go back and just recap the suggested edits. Oh, Lisa, you've got your hand up. Well, actually, okay. Lisa Sherrick and Lisa Riesly both have their hand up. Too many Lisas on this call. Lisa Sherrick.
Hi, Lisa Sherrick. I just would make the recommendation that perhaps actually, Joseph does have a comment on there for the first paragraph where it says the state's adult psychiatric agencies. That's a little misleading because it does have the regional centers in there, which would not be considered psychiatric agencies. So we could just, clean up that language a little bit. And I would probably kick this over to ADSD, but so it has the last sentence, the state's other adult facilities. So my understanding, Sierra Regional Center does not have a facility. However, they would have community providers that we discussed previous. And then I guess I'm wondering if rural regional center should also be included, if the goal is to target those direct support staff that fall under those umbrellas for those services, the SLA and JDT services.
So absolutely, yes. And so what I wanted to do is recap the edits to this moment and then speak up if there's any others. And then we will move after that to make the edits, finesse them, and then have a meeting next week, ideally, to make a final approval of the meeting. So with Lisa's suggestion, which is wonderful, to edit that first paragraph to divide out those three core agencies, DPVH, ADSD employees, and ADSD contract staff. And then it would flow logically from there, Sierra Regional, Northern Regional, the rural regional centers to make sure that we have those delineated specifically. So the first edit is to specifically break out the agencies and the reporting divisions. That's really important. The second piece to talk about is HR. So I think if we conceptualize it, the first paragraph is introduce the agencies. The second paragraph is human resources, which is a combination of the edit that I think was Commissioner Riesly made about the class and compensation study, number one, the barriers that are related to the human resources system with respect to onboarding and the process, and the challenges with not being competitive to the private sector. So those would be the three core issues to mention in the second paragraph. The third paragraph, as we talked about, has to do with turnover, and we're going to get both the DPBH and ADSD on turnover rate, which we didn't have in this letter, but we would have that. And any other employment specific things. So be it, I can't remember who it was, maybe it was you, Dina, that said you sent over the salary ranges, and we would be able to add that and make the mention of turnover rate, salary, and the need to be aligned with the Department of Labor's living wage for any of those regions. And I would add to that the additional sentence, as Stan brought up, that being a nurse in, say, a pediatrics clinic is one thing. Being a nurse on the floor at Stein Forensic Facility is a totally other type of job. And so there's differences in just the mental health toll on the folks that are the frontline workers in these positions, be it mental health technicians, the nurses. And so if those are the three core paragraphs, then obviously we tie it up with, here is our specific ask, a class and compensation study to do it ASAP. And to bring our workforce to a competitive level such that we can better support the citizens of Nevada that need it the most. Commissioner Risley, you've got your hand up.
And just one quick comment on that. I just want to make sure that in the second paragraph of the letter where we talk about the class and compensation sort of review and process and what does that look like to deal with the employment issues, that we also capture the component that was raised by Commissioner Ficalora on the contractors. So until we have really worked through the issues with the salaries that the contractors are offering folks to perform the job, then we will not really have solved the problem. So, to the degree that the state is evaluating with the AG's office on whether or not they can include those requirements in their contracts with providers, I think we should support them in that effort and that review, so that there is some parameters put around, what is being paid to people for the work that's being performed.
Thank you. Lisa.
Hi, Lisa Sherrick. So Chair, would it be amenable to you? I think it might be easier if perhaps Dina and myself work with our respective division staff, edit this letter, provide all the details, and then it's obviously will be a draft, and then we can provide that to this group where we can look at it. It sounds like perhaps next week, make any further clarifications or edits, and then potentially finalize that. Since really we're the ones that would have the information and understanding to make sure that we're providing you the necessary information to make that informed decision and sending this off should you choose.
Thank you, Lisa. Very much. I think we would appreciate that. This would be a great moment if there are no additional comments to make a motion to move this process forward, perhaps as Lisa just described, which I think is an excellent game plan. Are there any commissioners that want to speak up or any additional comment before we wrap up with the plan?
So this is Lisa Risley. I'll make a motion to move forward with the development of the letter, sort of in the order of the outline that was presented by Commissioner Durrett, with the input and finalization of data from the state administrative staff, to come back to the commission for final review and approval.
This is Commissioner Mosby. I second the recommendation.
Thank you, commissioners. Any discussion? All in favor?
Aye.
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 Any opposed? All right, that's a lot of work to get done in the morning. And thank you all for joining and coming up with so many very, very helpful and substantive comments. Joseph and Lisa and Dina will be working together to get some of that data compiled to finesse the letter. And then as far as a follow-up meeting, I'm trying to figure out, do we even have a commission meeting on the books for next week? No. Are there any barriers to same place, same time next Thursday that anybody can identify from the commission and or staff?
I am unavailable most of next week because I'm traveling for work. So I can tell you right now, it's just not going to work for me.
Two weeks from now, the 28th, gives a lot of time to get things done. See some hits. 2 weeks good enough to get everything done? Lisa's got her hand up. Is that your hand up as in that works for you, or your hand up as in you have a question?
Hi, Lisa Sherrick again. I apologize. I should have brought this up. I believe this is the same body that does the Commission on Behavioral Health for Children. Is that correct? I don't know if it's appropriate to bring this up in this meeting, but is there an appetite, or has there been a determination that perhaps this letter should include the staff that also work in those facility types for the state? And then as well as if, I don't know how it looks for contract services, that's not my expertise, but at least perhaps adding in the state facilities under DCFS, is that something to consider? I don't know if we can, since it's a different group, a different meeting, but the same body. So I just wanted to bring that up.
Yeah, I think you bring up a really good point. I think it might, and other commissioners speak up, might be more effective to take the body of the letter to our DCFS counterparts and recreate a very similar letter, but that's DCFS specific. Does anybody else have thoughts or comments about that? Joseph, your hand is up.
My only comment is, since this was kind of generated because the different facilities at DPBH and ADSD brought forward their concerns during our last meeting. So, I mean, I don't personally attend all of the DCFS ran child mental health meetings. I don't know if their facilities have brought up similar concerns. I'm sure that they would probably, like to have that conversation with the commission, maybe at a future meeting. But I do remember that you all wanted to send this out as soon as possible as well. So maybe, have them maybe send a separate letter if that decision is made at a later time, and try to really focus on this letter being sent out as soon as we can.
I appreciate that. And with everyone's permission, I'm going to make a motion that we effort to expedite this letter and recircle back on the 28th at 9 a.m. And as soon as this letter is completed, we will share it with our DCFS counterparts and then effort to create a parallel letter.
Commissioner Ficalora, second that motion.
Have a second. Discussion? All in favor?
Aye.
Aye.
Opposed? Abstentions? All right, we've got a game plan. Thank you all. That's a lot of work to get done in slightly less than an hour. Go forth and have good weeks. And then I'm excited to see what our final product is, and more importantly, to make things happen.
We do have one more public comment period, just in case anyone would like to make public comment.
Somebody's keeping me on track. Any public comment? Well, hearing none. It is 9:53. We're adjourned. Thank you, guys.
Thank you.
Thank you.